Welcome to Georgia Neurology Residents Association podcast. It's our second episode for now. And we have here the great Professor Alexandre Bisdorff. He's the father of the Vertigos. It's like that, we say it. He's the chair of, he is chair of Association of Luxembourg Neurology Society. It's Emirates Neurology Society. Yeah. So he's one of the best professors and best players in our league. Very big hearted person who we young neurologists are looking up to. He's kind of light we are looking up to, and he's guiding light. That's the most important, guys, because such kind of people have a very big impact on our society, on health of human, of understanding this field. So, Professor, thank you for joining us today. It's a big pleasure to having you here. And the most important is why you decide to go in neurology, and what was the reason and the spark that was most important in your decision.
Well, when I had finished my studies, I knew that I would not like to become a surgeon. I wanted to do internal medicine, and I started actually with internal medicine. I did cardiology and nephrology at the start, and then I realized that you need to choose an organ, because it was internal medicine developed in a way that you cannot do general internal medicine, although that's debatable today. And then I thought, which organ shall I choose? And then I found the most interesting one is actually the brain. And that's how I got into neurology. I must also say that during my studies, I came across obviously many doctors, and the neurologists were also those who impressed me a lot by their way of thinking, by their way of approaching, and that's what eventually made it.
Professor, so why you focused on your studies, especially on dizziness and vertigo and vestibular disorders? Why you choose this field?
Well, that came a bit later. I did my general neurology, and then I thought that within neurology is also good to pick a special topic. And then I had the opportunity to spend 2 years in London at the National Hospital for Neurology and Neurosurgery. And there I did it in the Vertigo area. So I could do a 2-year research fellowship. And I was there with the best people, and they introduced me to a totally new world and a new way of thinking. And that's how it got going. Since ever then, I have been involved with Vertigo. Later on, I learned a very nice phrase which says, once you get into the labyrinth, you don't find your way out anymore.
Wow, that's really great words.
Yeah.
So what I wanted to ask you is that also, could you say to our audience, please, why is it crucial to have a standard and standardized classifications for vestibular disorders? You spoke it in the conference here.
Yes, that is is a topic which has been following for a long time now. When you are in a field where diagnosis is built a lot on symptoms and on syndromes and on trigger mechanisms, and not so much on a gold standard test, then you need operative criteria. And the day I realized it fully was when I was attending my first headache congress. That is now a long time ago. And I realized how much the headache field profited from building the International Classification of Headache Disorders, because when you use the word migraine, then, and everybody uses the same definition, then you can do studies on epidemiology and on treatment and on whatever you want. But if migraine means something different in Georgia than in America than in Germany, then you can't. So you cannot publish, you don't know what people are talking about. And that very problem also existed for vestibular disorders, because there's often no gold standard, or you have tests, they are abnormal, but across different diseases. So you needed to have these consensus definitions. And because of my stay in London, I could join the Barani Society, which is this international vestibular society. And then I met people who are thinking like me, and then I took the lead of building this classification committee with the support of our peers, because the senior people, they supported that. And then it started very modestly at the start, but in the meantime, the classifications and the definitions we have developed are everywhere in every congress on vestibular. And that is a big difference. And it is still an ongoing work. It is actually never ending, because classification is always based on your present knowledge. That knowledge is never perfect. So the definitions are also not perfect, and you need to update them all the time. So it is an eternal building site, if you want, but a fascinating one as well.
Thank you. So I'm interested. So can you share some of the most rewarding moments in your career that you had, or one moment maybe that reward? I mean the career highlights thing. So what were the highlight moments in your career that changed this field and that changed the view, not only you, as the world sees this disorders thing?
Well, I don't know if it is one special moment. I think it is when you realize that your work becomes visible and makes a difference. I can tell you, when we started, one of the big diseases in vestibular is vestibular migraine. And when we started to work on that and define it, we knew we should do it together with the Headache Society, because they are very important. And at the beginning, it was difficult to find people who were happy to do it with us. And they were still very cautious, because it is a field they were a bit suspicious about. And you know, the people who could make the link between the two diseases were the neurologists. The neurologists who know also vertigo, because the problem is when you have a vertigo patient, you also need to know well the differential diagnosis. And that is obviously not a knowledge that standard neurologist has. But if you're interested in vertigo, then you go into the field of otorhinolaryngology. But the ENT colleagues, they don't know headache very well. For them, if a headache is in the front or here, it's sinus. And they don't realize that it's usually not sinus, but something else. But those doctors who knew both fields could marry these two things. And that was a difficult birth. But now you can see that the important people in the headache field and in the vestibular field of ENT, they embrace it, and they realize that we were actually too cautious, that we made the definition too strict, that it is even larger than what we said. And then you see that the field is really expanding, and people get now the right diagnosis worldwide. You have the publications around. Another field is the triple PD, this persistent perceptual postural dizziness, which is a behavioral complication of vestibular disorders, where people after a vestibular event, and that event could be a neuritis, or it could also be dizziness after head trauma, or it could also be dizziness due to a syncope, triggers a constant sense of swaying, of being hypersensitive to moving scenes. This is a visual vertigo. And that was also a very difficult birth, because some groups had defined it, called it different names, and to bring these together was a challenge. You know, one of the things, and that is something you have to, because you are a young generation. When I was young, you had many times a phenomenon that you had schools which were university. You had the Munich school or the whatever school. International societies are there to overcome that and to have a global consensus. That is what guidelines are about, what definitions are about, and not the schools. That's important.
I think that's really great advice for us. Thank you, Professor. So let's go a little bit outside the neurology.
Okay.
So outside the neurology and your professional life, it's hard to have a balance between professional life and your leisure time.
Yes.
So what do you do? What are your hobbies? And what do you do in your leisure time? How you relax yourself?
Well, I relax myself in two ways. One is I like to do walks in nature, and I like to read about history and anthropology, and also some for example, evolution is a topic I like a lot. Evolution in all its aspects, and especially I think in evolution of behavior. So the evolutionary psychology is I think a fascinating topic. When I go somewhere, also like here, I try to understand where you come from, because that's the only way of understanding who you are.
That's true.
And I think when you came here and you asked questions, you obviously were very well informed about your past, which I appreciate a lot, because I think people who don't care about their past, they miss their present as well, and they also miss their future. And that is also how I live. So I want to understand history. I think if I ever stop my medical career, I might take history studies.
That's pretty fascinating, and that's I think that's a unique way of thinking. Because with that you deepen your knowledge with that mindset. This kind of mindset is, I think, the one of the many reasons you are such a successful. So you are successful because you love what you are doing, of course, but I think that you are really interested in the meanings. You are interested in deep things, not what you see overall, not the face.
And that will take me to another advice I would like to give you as young colleagues, and that is, do some research during your training, because doing research is not the primary goal is not to become a researcher. The primary goal is to go through a school of thinking, because you have to go through it to understand how knowledge is created, and also how fragile it is sometimes at the beginning, and what steps it takes to consolidate it. And you will profit from that school of thinking for the rest of your career in ways you can probably not imagine now. I know that opinion I told you now is not shared by all of my colleagues. Many would say, why is that necessary? I just read, I go to courses, I do my continuous training. Why should I do research? It is something like an investment in your brain you will always profit from.
So, Professor, that's really good advice, and I want to also know from you what advice would you give, especially young neurologists who are interested in your field? I mean, this dizziness and vertigo, and in your field, what they should do now? What should they concentrate now?
Well, I think they should concentrate on what in every field will be very relevant, and I think you will predictively work differently than we will. In 20 years, I think the way we work has changed. So you should get a good basis in genetics, but much better than mine, and a good basics in immunology, and probably also in digital medicine and artificial intelligence, because that will shape and influence the way we work, I think, in every specialty, and you should get a basis in that, maybe tuned to neurology or tuned to whatever you do, but without that, you will not be able to follow the biology of what you are doing. I noticed that for myself. Now there are drugs out where I have to look up the biology of how they work. The drugs I learned 30 years ago, I had an idea about how they work, but now my studies 30 years ago don't allow me anymore to understand the biology of these new drugs. So it is a constant catching up. But it is predictable that genetics, immunology, and the digital tools will be important.
So, Professor, how do you see the role of AI? You mentioned it. So, how you see AI will help neurologists and your field in what way you think it will help?
Well, I think it helps as a tool because it is impossible to memorize everything. So you probably should consider these digital tools as a companion. So if you are confronted with a collection of symptoms you cannot really put a label on, you should have a tool which you feed with that and which gives you suggestions what it could be. So like a person you can ask and who has this wonderful memory and helps. But you should always keep your critical thinking because these machines will not be 100% reliable, and you have to know these things. You know, there is also one thing I get worried a bit about when I see how some of my colleagues function. That is that they are sometimes too reliant on what machines tell us.
Yes.
One of the fields we get nearly angry every day is that somebody has backache, gets an imaging of the back, you see an abnormality, and oops, people make a causal link. You see exactly the same abnormalities in people who have no back pain, and there is this lack of critical thinking is there. You have to, if you understand the method well, you also know its limitations. That is probably the most important thing you have to learn. Know its advantages, but also its limitations.
Yes, so you should not be only keen on the technologies. We should be free out of technology, and then the technology is tool just for helping.
Well, just is yes, just, but to use technology well,
yes,
you have to have some understanding of it, and you have to have analytical and critical thinking. Otherwise, you become a slave and probably also a bad doctor because, and you can be replaced. The question is, can we be replaced? Probably to some extent we can, but I think the role changes. It's not that we're going to be replaced.
Thank you. Professor, now you mentioned the roots, and I wonder who were the people, your mentors or mentor, who guided you, and which mentor made the biggest impact on you?
Well, I must say that in the beginning of my training, which I did in Germany, there was not a system which would really mentor you much. It was you had to go around. I had a head of department who was helping me, but he didn't do it in the way a mentor would do. I think if you build up a training system in Georgia, I would really advise to have a mentor system or tutor system, that you have a senior person who is something like your godfather or godmother, and who helps you to do your career. I had it done a bit later, and I think that's the people from London who did it, and it is Adolfo Bornstein. You might know his name. He's a famous researcher in the vestibular field, who was, I think, certainly my most important mentor. I am now also the program director for training of neurologists in Luxembourg. And I introduced that everybody has a tutor. And I think it is an important part of training because you are at your stage of the career not experienced enough to confidently take some decisions, and it is good to have somebody who can take you under the wing.
Yes.
And try to see what are your strengths and what are your weaknesses and what are your preferences, and say what is good for you and what is
it will be much more easier for us here in this situation.
Yeah.
Thank you so much, Professor, for these such a good things. But also I want to ask you, so what would you advise Georgia here? Because Georgia is a region, we are a developing country, and we lack of system perceptions, except despite the fact that we need good mentors and mentorship systems and programs and so on to us to evolve as young neurologists to become a really elite neurologist, which maybe is not a dream if we try hard and we learn hard. So we look up to people like you, because as we see you and your history, how you, with your hard work, with your knowledge, with your love to this field, how you perceive the world is everything for us, because it helps us to stay on the board. So,
well, I think it is probably now in a way easier than it was 20 years ago because of these European associations. The UAMS has done a great job in developing these European training requirements, and that is now done together with the EAN, the European Academy of Neurology, which is the counterpart of the Scientific Society. And these European training requirements are updated regularly. And what are these European requirements? But they actually define what a European neurologist should know and be able to do at the end of his training. And so there you can benchmark yourself wherever you are in the world. And it is the Americans probably have a bit of a different system, but it is not that different anymore. It is pretty harmonized, and you should look up to that. And I would really advise you to let yourself, to inspire yourself from these ETRs, adapt them to some extent to your country, because it cannot usually be transposed one-to-one, and try to pass the European exam.
Yeah.
and if you have done that, then you can have your self-confidence as well. It might be more difficult to achieve in your system, but probably not impossible to achieve if you make the effort.
Thank you for believing in Hester,
Yeah.
Professor. So, you had a very, very big career, as we know. So, was there a situation, for example, with patients, from which you learned from patients something that you, something good memory with patient, or something sensitive memory which then has reshaped your style of working? Was there some situation?
I think that, I certainly also did my share of mistakes. And I think the mistakes often arise when you are not careful enough in the way you work. When you are, how shall I put it? Housework?
Yes.
Housework at a home,
Yes.
Is something you only see when it is not done. Yeah? When it's messy, when it's dirty. And medicine has something to do with that. So if it's well done, everything goes smoothly and go. But if it's not well done, then problems arise. When you forget to make anticoagulation for somebody who is not mobile, when you are not careful about somebody who cannot swallow, and you get these complications. there is where you have to be a good housewife or houseman, whatever you want to call it, to avoid complications, to anticipate complications, to be aware of that. Also, don't jump too fast on a conclusion, because life is often more complex. There are differential diagnoses. Should always consider, when you see somebody, think of at least 2 differential diagnoses. I will never accept my students with that. Can it not be something else? It usually can be something else as well, or many more things actually. So don't jump too fast on conclusions. I think what I improved probably most in the course of my career is psychological skills in dealing with patients. Luxembourg is a small country, and you will meet people as patients you also know in different contexts. And you have to learn how to deal with that. I thought at the beginning it is not possible. You need to have a distance, but it is possible. And most of all, try to, when you see a patient, to scan very quickly what are his expectations, what are his illusions, and what are his anxieties. And then you know how to take.
The art of analysis is kind of like that.
Yes, and also don't think that the duration of a consultation is an important mark, because if you are in a emotionally very taxing situation, you cannot absorb a lot of information. It's better to try to see how much can you say now, and maybe stop at the moment and offer to see the person again in not too long time, rather than overload them for an hour with all sorts of information. It will not take you very far. This would be my experience.
Thank you for sharing. Yeah. Professor, so I wanted to ask you also, because for us, for young neurologists, it's very important to understand the way you think, because if we understand how you think, we can remodel it to ourselves, and then we could start doing good things happening in our life, we mean in professional way, in studying way, and so on, so on. So what was maybe in your life, in your career, there should be, maybe, I don't know, there could be situations where you don't want it to go on or something like that, and what was your sparking light? What was your motivation to stay on the float?
Well, if you the situations which are difficult are when you did something which was not good, when you missed something, a diagnosis or so, which will happen to everybody. Then it is, I think, important that you have colleagues who support you.
Yeah.
Because they will on the whole understand, because everybody has gone through it. And what you have to get out of that is to improve and not to repeat the same mistake. It is, because if you lose your confidence, then you lose your ability to take decisions, and that is terrible. I think it is a working environment which is at least that you have. It does not need to be a colleague of your own specialty, but you need to have a bit of a network of trustful colleagues to whom you can go and cry sometimes if you need it, and to be there also when they need to cry, because it happens.
It's great words, because not nowadays, even the doctors never speak not about their mistake, but about their feelings, because you are a doctor because you love people and you want to help them. That's the main reason I think that everyone is becoming doctor. So the situation when patient has some trouble because of doctor or because of situation, no one thinks I'm talking about now patients and relatives of patients.
Yeah.
So I need them to think that you are the person, the doctor is the person who want the most his or her patient to feel well, and that's why we are in the war. And when you lose, sometimes it's too hard to stand up. But still, maybe I think that it's how many times we stand up. That's why we don't lose.
Yes, you should actually arise stronger from a problem, and then you should also not underestimate the role you have to a patient, because if the most terrible thing I think to a patient is if you drop them, or if they feel that you are not interested in them, and that is also, by the way, something about where you see, I think, good or not so good colleagues. When you ask somebody, how many interesting patients did you see today? Interesting is whatever interesting means. And I am maybe lucky to say I see interesting patients every day. And what does that mean? That I'm interested in them.
Yes,
because people who don't see interesting patients, they are not interested. Because no patient is exactly, or nearly no patient is exactly a textbook patient. So you always have something new, something different, something which is unusual, which has to make you think, and something you never heard before. And this level of curiosity is also something you should preserve all your career, because otherwise you get bored and you get into routine, and you will not do the job as you should, I think.
Thank you. So what I wanted to say, it's the last question for today. So we are now in Kutaisi. For you to know, guys, we are in Kutaisi, in Georgia. So what do you think this GAMS conference would give our society, and how important you think such kind of conferences and such kind of annual meetings like congresses, conferences, as workshops would benefit Georgia?
I think it is a bit of an unusual conference in the sense that this goes across so many topics. That is certainly unusual as a meeting. It is. I don't know how you set up the program, because I don't know if there was a guiding thought behind it. I would because my impression is that some topics are a little bit one put next to each other and not so much connected amongst each other. I think a meeting should have some kind of red thread, which somewhere links everything together, so that all the people who attend get something out of it which is interesting for them. If the topics are too disconnected one from the other, that is then people go to some extent, or they lose attention, or or you have to make parallel sessions. Maybe you have something you do that on that topic and something else on another topic in a more workshop type of event, because it is not easy to. If you want to build a program, I think it should have a overarching something which glues everything together, or you make parallel sessions, or you make part of it and part of like that. I think it's not easy to make a program which is spot on and interesting for everybody all the time. That is my advice I would give. On the other hand, I think it is also an advantage to have events where you meet colleagues from other specialties.
Yes.
Because otherwise you're always in your same soup.
Yes.
And you lose the
Gen Z call it bubble.
or bubble or whatever you see, and you don't see beyond your horizon. in that sense, it is also a good thing, but it should be maybe, I don't know, that's my impression.
Yeah, thank you so much for your advice.
Yeah.
So, our podcast is going to end now. So, we are having Professor Alexandre Bisdorff. He's one of the greatest neurologists in the world, as maybe ever, because as you see, Professor Bisdorff has very, very kind heart. He's very big-hearted, very generous, because it's good and it's perfect for mentor for me as a young neurologist to have big heart and to be generous. Because it's easier to say a lot of good things that it was brilliant, but a real friend and real mentor and who wants good for you says also what was mistake, what was this, what needs improvement. This is the kind, I think that this is the kind of friendship. This is the kind of real friendship. Thank you, Professor, for having us today. And I wish you long and beautiful, very interesting life as in profession and outside of profession. And be always happy. That's my and the young neurologist wishes for you. Thank you so much.
Well, thank you so much for having me, and I am, from my side, very pleased to see the enthusiasm in the new generation, and I'm confident that you will do your way, the way you need to do it.
Thank you so much.
Thank you.
It was really great.
Was it good? Yeah.
Yes, perfect. I think you were too elegant for this.
Too elegant?
Yes.
Well, I was just myself.
Yes. Thank you so much. And then.